Hey everybody, it is Felicia Taghizadeh, owner at Arizona Facial Plastics, where we are your partners in positive aging. And today on this live video, we are going to be talking more about the Frozen C, which is cryotherapy for aesthetics and how we've been using it. And today we actually have a special guest. We have Dr. Taghizadeh.
Hello everyone.
And Antoinette is going to be doing his cryotherapy treatment. And so Dr. Taghizadeh is going to actually demo the Frozen C for us. And then when he's done, he'll give us a few talking points on why he thinks that the Frozen C is such an amazing, cool new device and what it can do in aesthetics. And then Antoinette is actually going to show us some pictures of patients who've been through the cryotherapy treatment. Sorry, something weird is happening with the audio where I can hear myself talking. Super weird. It's all like a 4-second delay and then it's showing up in my headphones. Okay, I don't know what to do about that. I'm just gonna try to ignore the voice in my ear and let me get a thumbs up that you guys can hear me okay. Yes? All right, you can hear me okay. Ignoring the voice in my head. So Antoinette right now is applying the special, what is that, glycerin gel.
It's an
Talk louder.
It's an anti-freeze serum. Basically acts as a barrier between the skin and the cryo. And yeah, we're just smoothing it on real quick so he doesn't get any frostbite.
Can I say something?
Please.
It is 110 degrees outside today. I'm so glad I'm getting a Frozen C and not a laser.
We're gonna chill.
I'm telling you, I
chilling.
need to chill. I just drove in and it is so warm outside. So
I think it's
perfect thing for the summer in Phoenix.
It is. It's a perfect treatment for the summertime. So one of the things that we've noticed with the cryotherapy treatment is that it's a great add-on for your summer beauty routine, because in the summer it's kind of hot to be getting lasered. You can still do it and we'll help make it comfortable for you. But if you're too hot or you're going to be outside or you just need to cool down a little bit, then cryotherapy is a good option. So she's getting started here with the Frozen C. Okay, you don't have to be silly. He is a little bit of a baby though, and this gets very cold. So Antoinette is doing the Frozen C, and it's kind of cool because it actually has this dual, it's also very ticklish. It has these two laser beam lights that come out of it, and as they separate, do it again. There we go. Okay, so you can see how there's two jets of light. When the two lights come together and form one spot on the face, that's how we know that we're at the right distance from the skin. So it's actually a really cool technology because it helps you, cool technology. The machine actually gives you a really good visual guide for where you should be in terms of distance from the skin to get the right treatment for the patient. And this room, I just have to apologize. This is a mess right now because we are testing this Frozen C device. So we have all of these gas tanks here and another big ugly gas tank. I don't know why the gas tanks are so ugly, but the stuff there. Okay, he's laughing. He's like super ticklish here. So the cool thing about this device again is that she's gonna try to get the light beams to equal one beam of light. That tells her that she's the right distance. And we keep the Frozen C moving in circles around the skin because that allows you to get the skin colder without it being too painful. Then the device here is actually telling us the temperature of the skin. So you can see the number changing over here. That's the skin temperature. And it helps us get the skin to the coolness temperature that's desired. The other thing that's awesome about this device is that it does shut off automatically when the skin reaches the right. See, he's a baby. Look, he can't handle it. It's too cold. Man up, Dr. T.
I can't breathe.
Do you want the Pronox, the laughing gas? He's already laughing, but this is what you get when you get ticklish doctor with a little bit of a pain baby. Okay, maybe distract us a little bit. If you can talk loud, tell us what you like about the Frozen C device here.
Oh, I love it. I mean, the treatments have been very effective. The patients have really liked it. Its best indication is actually for pain. So it really reduces the pain if you're doing it anywhere on the face or on any part of the body. But outside of making me laugh because it was tickling me, I love the treatment. And the nice thing is it's so warm today. Like my whole central core just cooled down. It feels so good.
I think you can open your eyes.
You can open your eyes.
There you go.
Yeah.
Hey,
So,
Dr. T.
Hello, everyone.
So what is this actually doing for the skin? Why would patients come in and get this done other than that it makes you feel cold?
Well, there's a couple of benefits of the frozen C. The first is that it is a nice little micro peel. So it's a nice way of getting the light peel effect on the skin.
And we actually are combining this treatment with a papaya enzyme that you'll do before. And different practitioners, different offices will use the frozen C differently. And what we do with that papaya enzyme is try to get that first top layer of skin, the dead skin, to just come off so that when you get the cryotherapy, it's actually penetrating more effectively.
The second thing that happens with this machine is that it kills bacteria. So we have all this dead skin and bacteria that we have to carry around every day, and the carbon dioxide is actually very good for killing all bacteria. So there's a calculation called porphyrins, which is a way that you can actually tabulate how much dead skin and bacteria you're carrying, and the frozen C is perfect for significantly reducing those numbers, which is critical for reducing inflammation and improving skin health. And the final thing that I really like about it is that it helps improve perfusion or oxygen flow into the skin. So it's kind of ironic that putting CO2 on the skin actually improves oxygenation, but it actually works exactly that way.
Pull this down a little so we can see the cool, there we go.
What happens is that the carbon dioxide actually stimulates the hemoglobin that are going through the little blood vessels in the skin to release more oxygen to the skin. So it's a fantastic way to actually improve perfusion of oxygen into the skin, so the skin is healthier and happier. The other amazing thing about this machine, and I think, for anyone who's done it on a joint or on a sore back, or literally like just my face, it's absolutely amazing for pain. So, I just did a bunch of surgeries today, and you're standing there and you're wearing a mask and you're wearing a hat and your face gets sore. And literally right now my face just feels incredible. It feels amazing.
So it sounds like the main things that you're seeing is that it's improving oxygen flow to the skin. It can also help with pain, which in our practice we use actually with really good results for people who have bruising to help them recover after they have injections. Right. We also use it before injections so that people feel the injections less. Right. And you're saying that some people would even use it for joint pain. What can it do for acne patients?
So there's a couple of things that happens with acne patients. The first is that there's a bacteria, Propionibacterium acnes, which is actually the bacteria that causes...
Louder.
It's actually the bacteria that causes acne. So what ends up happening is that with acne, usually there's a cell in the skin, it's called the sebocyte, so sebum, and your sebocytes become very active, so a lot of people have oily skin, and this could be related to lifestyle, diet, or whatever. And the sebocytes make a lot of sebum. Well, the bacteria like to eat that sebum, and then the bacteria basically live on the skin, and the bacteria stimulates a lot of inflammation in the skin.
Ew.
So, yeah, exactly. Ew, who wants that?
Ew.
Well, the frozen C basically sterilizes that bacteria. It kills the bacteria. It suppresses the sebocytes from making sebum, so you don't have as much bacteria in the future. And it also does a nice peel effect, so that in essence, the skin is opened up and it essentially dries out the acne. But what's awesome about cryotherapy is that cryotherapy has actually been around for many years in different forms as one of the best acne treatments. But what we're finding with this new technology, because we have temperature control, we have distance control, it's a smart machine, it has a lot of new features, is that you can really do effective acne therapy with it. Now, again, indications, testing, that's all going on. But in essence, cryotherapy with CO2 is one of the classic ways of controlling acne, and it's a classic way of destroying the bacteria that causes acne on the skin.
So acne, it sounds like acne can come from a lot of different things, and I know that it's related to gut health. However, what we're seeing with this machine is that if you're trying to control the acne from a topical perspective, it does two things. One is that it's actually killing bacteria that's already on the surface of your skin. The other is it's killing the food that the bacteria would live on. So it's making it a less enjoyable environment for those bacteria.
That's right.
How many treatments are people needing to see results with acne?
Well, I mean, from the Korean data that we have seen...
Which, by the way, hi, Hubert. Hubert's watching.
Hi, Hubert.
Hubert is our Korean hookup for the Frozen C. He gets to travel around the world telling everybody about the frozen sea. So the
Yes.
Korean data is showing.
The Korean data is showing usually 3 to 5 treatments is very effective for reducing acne. We have seen in our practice, again, looking at the porphyrin counts on our original data, that the porphyrin counts, even after 1 treatment, come down significantly. But again, I think it's all part of skin health. And the thing that I love about cryotherapy, and let's just be honest about it, right now across the United States, it's summertime. It's hot everywhere. People generally don't like to do lasers. They don't like to do therapies that stimulate further heat collection and further inflammation in the skin. And cryotherapy is a great way to reduce inflammation. It's a great way to refresh yourself. So I really feel refreshed. I mean, it just feels amazing. And it's also a great way to continue your yearly regimen for skin health.
Okay, awesome. That was Dr. T making a cameo in our video. Bye. He's got a call that he's going to get on.
Thanks, guys.
So thanks for being our demo patient there. And now we are going to go over with Antoinette, who has been doing this study on the frozen sea, where we are in the process of getting it FDA cleared for some different indications. And so Antoinette has really been collecting the data, and she is going to take an opportunity to show us some pictures. And so again, the reason that I wanted to look at these pictures is because a lot of patients will ask us, how soon will I see results, and how many treatments do I need to get done, and how long does it last for? And one of the things Dr. T said that I think is really important to remember is that this is part of a regimen for overall skin health. And so like many things in aesthetics, it's not a one and done, right? It's something that you add into your routine, especially if you have active acne, where you are taking extra steps to promote an environment for healthy skin. You do that with home products, right? Check out my last video that we did on the products we offer here. So using the right products for your skin, using the right skincare regime in an aesthetics office, right? So that can include something like hydrofacials. It can include at-home creams that are like with tretinoin, other actives in them. And then it also includes adding in these new technologies like cryotherapy, which again, if you have active acne, is going to kill the bacteria on the surface of your skin that's causing those acne breakouts. And then also what we're seeing is it's suppressing the production of sebaceous oils, I think is what he said. Suppressing, what are they called? Sebum, suppressing sebum, not an esthetician, suppressing that sebum, which gross, the bacteria likes to eat, so that you aren't producing as much food for the acne causing bacteria. I'm sorry, but that's just a really gross concept. Yeah, it's yucky.
Not all sebum is bad. I got sebum.
Not all sebum is bad.
I don't have wrinkles.
No. There you go. The more sebum, the less wrinkles. But you might have some acne breakouts. Yeah. Okay, I'm going to flip the camera here because we're going to look at a few pictures from patients who have enrolled in our study and have released their photography rights, so I can show you the pictures here. All right, so that one is pretty amazing. What are we looking at here, Antoinette? How many treatments?
She had 3 treatments, 1 week apart. This is her baseline, her first day. And we did this picture right before her treatment. This picture is her 30-day photo after her 3rd treatment. And Dr. T spoke about acne, and we were talking about sebum and all of that. I mean, look at how cleared up she is. The redness is gone, the inflammation is starting to dissipate, and that's only after 3 treatments.
And check out the forehead too. I mean, the cheek is amazing.
Yeah.
And the forehead also, you can see some pretty huge improvement there. Now again, this is not like, people say, well, how do I get perfect skin? Come on, people, there's no perfect skin. Like, there is airbrushing, but what we're looking for is things that you can do to improve your skin so that on a daily basis, you're just more confident in your skin, you're using less foundation, using more products that really enhance your natural beauty rather than having to cover up who you are. And with results like this, we're getting her back to a baseline where she's just going to feel more confident on a daily basis. And instead of wearing like huge amounts of foundation, which a lot of people do, that can also actually make it difficult for your skin to recover, you're just getting back to more of that baseline where you feel confident and beautiful in your skin. So let's take a look at her pictures one more time. Pretty amazing 30-day transformation there with 3 treatments on the frozen sea about a week apart. And now we're asking the people in the study to not be doing other things while they're on the frozen sea. So this really is from just the frozen sea treatments.
Yep, and good skincare.
Good skincare too. Yeah, skincare at home.
Let's see, we can look at another. Let me get in here real quick.
Okay, so she's going to go to another patient that we can look at. So another cool thing at Arizona Facial Plastics that I've mentioned in some of my other videos is that when you come in, we are very data driven. And so we are going to take your pictures just like the ones you saw at pretty much every consultation, because that helps us show you the progress that you're making. Or honestly, if you're not having progress, we want to know that too. That's how we are able to change your treatment plan, adjust the devices that we're using, and really make sure that we're getting you results. Like, it sucks to be going somewhere and have them tell you that your skin is getting better, but not have any evidence to back it up. And so with our camera system, the photography that we have in this room, our 3D system here, sorry, that's the 360-degree system. That's the 3D photography system. And then the Vizia that Antoinette is pulling up the next patient on. With all of this data, we can really show the progress that's happening for you. We also have a really cool app that we use called My Touch MD, where any pictures that we take in the office, we can upload into your app. So when you get home, if you don't exactly remember what happened, what kind of changes you saw, you can just log into your app and the pictures will be there. And then also everything that we do for you, like the information about the devices, the information about products, all of that will be there on the app so that you can find out more. We want you to be educated. Education is power. Education is power. Stay up to date. I don't know what that means. Whoever typed that comment, stay up to date. What are you talking about? All right, I think we have our next person up here.
This is another study patient. Again, 3 treatments, 1 week apart. Before her treatment, her series of treatments, and then 30 days after her 3rd treatment. And what we were looking for is improvement on texture and overall, just overall illumination of her skin. And you can really see that where here she was looking pretty dull at her 30-day. Her skin did look actually much brighter. So
I think it's also pretty awesome to look at. So this is clearly not someone who had acne, here. Right? Mm-hmm. Yeah. So if we look through, and I'm kind of looking at through this whole cheek area here, the before and the after, that she almost looks like she's getting a little bit of a lift from it, right? Like there's something happening in terms of improved blood flow to the skin, improved oxygenation, which Dr. T was talking about, that is making her skin just look healthier, more beautiful, and I think definitely more youthful, right? Mm-hmm. Like her, I think her chin position here is what's causing the wrinkling. So don't be a hater. I can see that too, right? Like she's pushing her chin in there and it's a little bit lifted in this one, right? But I'm looking in this triangle up here compared to this triangle, which is not impacted by her chin position. And her skin just definitely looks a lot better. I also think that there is more evenness, right? So over here, we're seeing like really a lot of highs and lows of reds and browns. And over here, you can still see the reds, but the whole texture and tone is just smoother. And like you said, more glowy, more youthful. Yeah.
Let's look at the other side and see if we...
Oh, we'll take a look at the other side of our face. So this camera, the Vizia, does 3 images. It does the front, the left, and the right. And this now is the left side of her face. And again, this is the before on this side, and this is the after here. These pictures are from March 27th to May 13th, so almost 2 months. April, May.
A month and a half.
And I think you really do see just, again, that rejuvenation of the skin. It's hard to actually quantify what happened, but when I look at it, what my eye sees is, again, a general migration of everything upwards. It's just looking lifted, fuller, smoother. The color is better. And I think her pores are actually smaller too. Oh yeah, that's what we're showing here, right? So she had a pore count of 555 and it's gone down to 490. So there's actually been a decrease in the number of pores that the device is counting on her face. She put the little purple dot mask on. That's the before. And those are the little purple dots. Those are the pores afterwards. Mm-hmm. Why is that important for skin health, the reduction in pore size?
What happens is the oil production in your skin, when you're producing more oil, your pores can look enlarged. When we're doing the frozen C, and it's bringing down that sebum production, so then your pores do appear smaller. So it's another nice add-on to this, and that's what we're looking for in the study, is improvement on tone and texture. So we see a little bit of that here in her picture. So I'm very proud of that, and she looks great.
She does, yeah. I mean, it's almost what we would look at a 30-day result from a CO2 laser. It's actually almost how good that it looks. So those are a couple study patients that I wanted to show you with that frozen C. Today's video is not going to be super long because, let's get real, it's Friday. And sometimes you make a commitment to doing things and then you just get it done. But we're super excited about that frozen C. We would love for you to come in and try it. This is the Arizona Facial Chill treatment. Our full experience includes a papaya enzyme, which is going to exfoliate the skin. It includes the frozen C treatment that you saw Dr. T get. And then we actually do a cucumber chlorophyll mask at the end. And that whole experience is normally $199, but we are running a special right now for $99. This is a great treatment to come in and try during the month of July. That special is not going to last forever. And make sure you come in and do it before wintertime hits. You can do this treatment all year round, especially if you're looking for improvements in reds or you have ongoing acne. This is something that you would just work in to your normal skincare regime. And we actually have a membership program that I'll be talking about later, which is a really easy and affordable way to pay for the treatments. But for now, instead of it being $199, just come in, mention the video. You can have the whole Arizona Facial Chill for $99. And again, we're looking at usually 3 treatments over the course of a month. And you'll get the improvements that you saw in the picture there, right? Like, you'll see that progress in your skin where it's looking more youthful, more radiant, more glowy. You're getting more oxygen to the skin. It's reducing the reds. It's suppressing that sebum production. That's my new word of the day, sebum. Suppressing that sebum so that your bacteria have nothing to eat. And you're just going to have prettier skin. So we at Arizona Facial Plastics would love to be your partners in positive aging. We are always excited to work with you, share what we know, and help you have an amazing journey in your life where you look as beautiful as you feel. So thank you so much for watching. I'm Felicia at Arizona Facial Plastics. Come in and get the Arizona Facial Chill, $99 instead of $199. And let us know if you have any questions. Bye.